We are here to talk to you today about thyroid testing, blood thyroid testing. Thyroid symptoms are so ubiquitous, so many people experience them. Things like weight gain or inability to lose weight, cold hands and feet, thinning hair, dry skin, constipation, depression, anxiety even, insomnia, right? Go on and on. These are very common. However, when most people go in to talk to their doctor about these complaints and they test their thyroid, typically it's one, maybe three markers that are tested. We're looking at TSH, or thyroid stimulating hormone. That's the default marker to test, and I'll elaborate on what that is in a few minutes. Maybe free T3 and maybe free T4 if you're lucky.
Yeah,
exactly.
if you're lucky.
Mm-hmm.
Yeah.
So to give you an idea, this would be the equivalent of taking your car into the mechanic because it's making a weird sound, it's not performing the same way. They check your oil and say that your car is fine.
That's it.
So that's it. So what we're going to do today is dive into the 11 different markers that you can run, that are imperative to run in order to get a full thyroid assessment. It's the patterns that can be found within these markers that can tell us really important information, such as, is there primary hypothyroidism? So is there true hypothyroidism reflected in a problem with the thyroid itself? I'm pointing because that's where your thyroid is. Could it be that your thyroid is fine, but it's actually cellular hypothyroidism? So you have all the symptoms of hypothyroidism, but it's not stemming from the thyroid itself. It's stemming from how your body is using thyroid hormone. Or could it be something completely separate, like stress, for example, that's affecting the utilization of thyroid hormone? So there's many different patterns that we'll see, and that's the beauty and really the importance of having a full assessment of the thyroid. And that's what we're going to dive into today.
And I think what we see a lot of times is that we have clients come in and they just had the TSH done, and they're told, you're within range, everything looks fine, but you don't feel fine.
Exactly.
Right? Like you're seeking another answer because you know intuitively that you don't feel fine. And we see this with women. It's becoming more and more common with women in general, where we see a hypothyroid or a thyroid problem. So we're going to share the screen with you and walk you through one of the labs that we could run and give you the data of why we need to look deeper at the thyroid, and we need to look at a much more narrow range profile, right? When we're talking about thyroid.
Exactly.
All right. Here we go. All right. Let's start right here, because this is where we typically see labs come in, is TSH. So let's talk about TSH, thyroid stimulating hormone.
Perfect.
Yeah.
So thyroid stimulating hormone is the hormone that is sent from the pituitary in the brain down to the thyroid, and as the name implies, it's to get the thyroid to do its job, which is to produce its two hormones, T4 and T3. Now, one thing I want to mention with TSH is, as I mentioned, thyroid stimulating hormone. The brain is always sensing how much available thyroid hormone is in the body. So if there's sufficient amount of thyroid hormone, there will be a normal amount of TSH. If there's too little, the brain will increase the amount of TSH sent to the thyroid, basically saying, hey, we're falling short, make more thyroid hormone. If there's too much, the brain will decrease the amount of TSH that's sent to the thyroid, saying, hey, cut it back, we've got too much, okay? So TSH is an important marker to look at, but it's not the only marker.
No. And look at this range here, right? So this is what we want to point out, is this is a clinical range, 0.45 to all the way to 4.5.
It's a pretty significant range when we're talking about a hormone like this.
And what we know is that most individuals play well in a very narrow range where you have the energy, you have the mental capacity, you have the memory, you sleep well, right? Where you're functioning.
You have the metabolism.
You have metabolism. So that's something to point out there, because if you fall within that range, you are clinically within range and you may not be supported.
That range, any lab reference range, is screening for disease. It's very broad in nature. We, on the other hand, use what we refer to as functional ranges. And functional ranges are determined by medical researchers studying healthy populations to determine what optimal is. We're screening for prevention. So those ranges are a lot tighter in nature.
This is looking for the sick range. We are going to point out what the healthy range is.
Exactly.
Yeah. And then for all intents and purposes, this 2.34
looks great.
Here, looks great.
Looks great.
Right. Nothing would ever be flagged right here. You're fine. Go home.
Exactly.
Okay.
And this person came in started off with some gut issues, like it's really bad gastrointestinal pain, stomach pain, bloating, random sporadic diarrhea, sometimes constipation, insomnia, really bad hot flashes during the day, hot flashes at night. So this thyroid profile is part of, as you can tell, a comprehensive blood panel. But we really want to zero in on the thyroid because the patterns are really interesting and glean so much information as to what's going on with this particular person.
Yeah, I think this client would have been completely missed had we not dug deeper. Okay, so let's talk about the hormones behind the hormone, right? The hormones behind the scene. The hormones, the T3 and the T4.
Exactly. So T3 and T4, the thyroid produces 93% T4 and only 7% T3. T3 is the active hormone. T3 is what actually gets in and does work. It influences everything from your metabolic rate, your body temperature, your ability to build muscle, your mood. Every cell in the body has a receptor for thyroid hormone. T3 does the work. T4, on the other hand, is essentially an inactive hormone. It needs to be converted to T3. Here's the reason why the body is organized in this way. Every different type of organ, every different type of tissue is going to need different levels of thyroid hormone. So rather than leave that responsibility up to the thyroid, the tissue does the work. So it converts T4 into T3 at whatever rate it needs to sustain its processes.
Isn't that fascinating?
It's very intelligent.
Our bodies are so cool.
Really cool. Yeah. So, but nonetheless, both of them are important. So when we're looking here at T4, the range I prefer to use is 6 to 12. So at 7.9, not too bad. Again, she's within range. Her thyroid is producing T4, so that looks great. I'm going to, for now, skip T3 uptake, skip 3-thyroxine index. In short, both of those reflect how the thyroid hormone is being used. Is it able to bind and actually convey the message that it's supposed to convey? Are there other hormone balances? Are there proteins? So there's a lot of other things that we can look at from that perspective. But I don't want to get too confusing. And so right now we're going to skip to T3, the active form of thyroid hormone. So here we're looking at total T3, just like we looked at total T4. We're going to talk about total T3 now. Just like we talked about total T4, we'll talk about total T3. So total T3, as I mentioned, it's the amount of thyroid hormone, the active thyroid hormone. 100 to 150 is the range I like to use for total T3. And so at 106, not too bad. Could that be a little bit higher? Sure, but again, it's not too bad. It's still within that optimal range. And one quick distinction, because I am saying total T4 and total T3, and we'll talk about free T4 and free T3, is that the totals just represent what's coming out of the thyroid. You can kind of conceptualize it in that sense. From there, we need the free levels of the hormones that actually get in and do the work at the cellular level. And at the cellular level means how we feel, how it makes us feel. Mm-hmm. So totals are important, but then we also need to look at the frees. What is bioavailable to do work in our body? So now we'll scroll down, see the free level of T4, free T4 direct, 1.31. Range I like to use is 1 to 1.5. Again, total T4 looks fine. Point that we're really making here is that we've seen a few different markers that would suggest this person's thyroid initially looks okay. In other words, if they go in for their routine physical, doctor ran TSH, free T3, free T4 even, these would look okay. Mm-hmm. There's a kicker though, so stay tuned till the end.
Because this is what we see
all the time.
All the time.
Mm-hmm.
Okay.
This person's flying under the radar.
Totally.
So free T4 looks fine, right? So far we're checking off the boxes. This person's thyroid seems to look okay. Next we see reverse T3. And reverse T3, that one's worth discussing too. Her levels are fine. I like to use 15 to 24 as the optimal range. 19.2 is fine. Let's talk about reverse T3. T3 is the active form of the hormone, right? Reverse T3 is a competitive binder. So what does that mean? Reverse T3 is during times of stress. It's produced during times of stress. Stress is largely mediated by cortisol. Cortisol and thyroid hormone are both very energizing hormones. If both of them are high at the same time, you're going to metabolically burn out. So as a protective mechanism, if you're undergoing chronic stress, the body's like, no problem. Let's just shunt T3 production towards reverse T3 to protect your body. So in other words, if we see that reverse T3 is high, you will have hypothyroid symptoms that are secondary to some form of stressor. Okay? Thyroid is fine. A second form of stressor is creating that cellular hypothyroidism, which relates into I feel hypothyroid.
Right. And I think it's important because we live in a stressful world. Yeah. Like we are stressed as a society, we are stressed out.
Absolutely.
And so we're seeing this present more and more and more because of our lifestyle. Mm-hmm. Maybe, like you said, not necessarily that your thyroid has an issue, but your lifestyle and how you're showing up and just how we have to operate in this world is causing the stress.
Exactly. Yep. Your thyroid is fine. It's the lifestyle that's the problem. We can't utilize thyroid hormone.
Important distinction because it's very common just to be placed on thyroid hormones without really spending time with you as the client to figure out, well, what does your life actually look like? Right? Is this a symptom of lifestyle?
Exactly. And in this case in particular, taking more thyroid hormone could make it a lot worse. We're going to build up and perpetuate that resistance.
Okay. So we've got our T3s and our T4s. I just want to say something about the T4 as well as when you're getting your thyroid run, right? You're having a thyroid lab run and you just get the TSH and maybe you do get put on a prescription pharmaceutical, right? Levothyroxine, Synthroid.
Yeah, that's a good point.
It's really important that you do know your T3, T4 levels because some pharmaceuticals don't contain T4 and you might need it. So that's why it's really important when you do ask for your labs or you come to us and you have them run, we're going to look at that to make sure if you do need a T4 supplementation that it's in the prescription or it's in the supplement or we're addressing how the body can make more of it.
Exactly.